thanks for watching this video. Today we're talking about a word people hate to hear, which is extraction. And in our office, we actually do not call this an extraction. We instead call this a removal, okay? And what this means is you need to have a tooth removed or teeth removed. The reason we don't call it an extraction is that sounds more barbaric and reminds us of the old days. But now we do things much better, and we have more gentle ways to remove your teeth without causing so much pain. So hopefully we can save teeth whenever possible. Most of the time we aim to do that. But there are some teeth that either have such bad gum disease or bone disease or cavities that we just can't save them. And if that's you, if you have a tooth or teeth that need to come out, I just want to walk you through kind of what to expect and why we're going to do this so you understand a little bit more what happens. Now, when your tooth comes out, if you have a tooth kind of like this, okay, and pretend this are your gums, okay, well, when your tooth comes out, you can imagine there will be a hole there, okay? So instead of leaving this bony hole here that would look like that, it's going to be a food trap, and it's going to cause your jawbone to shrink. We can do a couple things, right? Sometimes we can put an implant in right away. Because you already have this hole here, think about it if you took a tree out of the ground in your yard that was rotted or had been damaged from lightning, and you want to put a new tree in. So you can, one, put a new tree in right away, or two, you can put some earth or dirt back in that hole to then come plant a tree in later. But if you just leave the hole there and you water it and wind and weather comes, you're going to have this big defect and the ground's going to kind of shrink and cave in. That's what happens when people lose lots of teeth and they get that look like their jaw's caving in or their face. It's because our bone shrinks when we lose teeth. So instead, we can trick your body to thinking you still have a tooth there in one of two ways. The first way is we can put an implant in, and what that means is when your tooth comes out, we can put a new root in there, okay, shaped kind of like a screw, okay. We put a new root in there, and that root will just sleep in there for about 4 months while your bone fuses to it. And then at the end of that time period, we can put a nice new tooth on the top that will attach to that right there. And then your tooth will be back just like it was before. All right. Now, if we can't put the new root in at the same time, maybe because of infection or the bone's damaged or those kind of things, all right, we'll put a bone replacement in there. And that's a powder we put in, all right, we would put in either with or instead of putting a new root in. And that powder is like a calcium powder, and that allows your body to rebuild your own bone on it. And within 3 months, your own bone has formed back where the tooth was. And then you can come plant that tree, so to speak, or put the new tooth in there. Now, how long does this bone last for? Usually within 12 months is when you should have the new tooth put in, so you don't have to put it in right at the end of 3 months. But most people, when that tooth's been gone for a while, they're excited and looking forward to getting a tooth back. So we'll put the bone in. You have up to 12 months to put a new tooth in. After 12 months, the bone can start to shrink back again, and then it can be a little more challenging or involved to get a new tooth put back in there. Hopefully this helps, and we hopefully don't have to take out a lot of teeth, or at least if you're missing lots of teeth, we can replace them in a timely manner. But we want to make sure this is as comfortable as possible for you. Now, you don't have to remember all of this. We'll give all of this to you in writing. We'll walk you through it. We'll make sure your visit is comfortable. We will make sure that your mouth is numb. You'll be numb for usually a few hours afterward. If you want to just completely kind of tune out and not have to see or feel or hear anything, we recommend you do sedation. And there are a couple types of sedation we offer, but the most popular one is a sedative, some pills that you take. They make you very drowsy and tired, so it's safe because you're awake, but usually you'll fall asleep on your own or doze off. We can do the work and get that done, and you'll wake up and everything will be done. That's what our patients choose most often for wisdom teeth removal, as well as for removing broken or damaged teeth. And we hope this helps, and we look forward to helping you out and getting your bad tooth out so that you don't have spreading infection or lose other teeth, and then replacing it when the time comes. Thanks for watching.